Hi everyone, Dr. Jay Mehta here. I lead the chronic pelvic pain and neuropelviology clinic for India. It is important that we understand one thing. IBS, irritable bowel syndrome, is a very important cause of having chronic pelvic pain. Okay. This is something where your ultrasound is going to be absolutely normal, but you are still having severe pain, discomfort in the abdomen. It could be lower abdomen, it could be upper abdomen, it could be both. So just remember that thing very, very importantly. Now, IBS as such is a psychosomatic problem. Type A personalities, people like me, very honestly, the ones who are keeping on thinking, these are the people who actually get IBS. But when you are suspecting IBS, this is where the role of a multidisciplinary team comes in. Once a specialist like us has said that there is nothing in the pelvis, there is no endometriosis, there is no adenomyosis, no inflammation, don't worry. We would also send you to a gastroenterologist. They may do an examination and they may want to do certain investigations to rule out diseases like ulcerative colitis, Crohn's disease, inflammation in the bowel. They may want to do such type of things. Certain situations would be such where they may want to put a OGD scope or a colonoscope and take some biopsies. After all of this is done, quite a lot of times, they may put the patients on certain medications which are important for them to treat bowel inflammation. But remember, if your pelvic pain and if your pain in the abdomen is persistent despite that, or along with that, that is where the role of a multidisciplinary team comes in beautifully well, where apart from a gynecologist and a gastroenterologist, you are also to be seen by a neurologist, by a psychologist, by a pain management specialist, and by a behavior therapist. All of this, along with a combination of breathing exercises, good sleep pattern, yoga, all these things give you a holistic perspective. It will take minimum 6 to 8 months. It will take multiple sessions of counseling, but ultimately patients experience approximately a 70 to 90% benefit when all the holes are plugged nicely. So remember this thing. Chronic pelvic pain with IBS is something which is unbelievably common in India. It requires a holistic approach. It requires an excellent diagnosis. And then it doesn't stop at diagnosis. It requires a persistent treatment to help you subside your chronic pelvic pain, also called CPP, so that you can enjoy a better quality of life. And that is where super specialty clinics like ours with a multidisciplinary team would actually benefit the end user, which is the patient.